York School of Nursing is one of 9 universities that participates in the Primary Healthcare Nurse Practitioner program. We're located in North Toronto, and the campus is beautiful with many amenities. The program at York is a Master's of Science in Nursing, combined with a Primary Healthcare Nurse Practitioner certificate. It prepares students to write the board exam and then practice as nurse practitioners in primary healthcare.
We're a 5,000 square feet space broken down into a simulation lab and a computer simulation room. The space is fully convertible to suit whatever our needs are. It can be like a full-blown hospital ER space, or we could have like a small primary care room where you really get in that focus on a single patient and direct patient contact.
What makes the York University Nurse Practitioner program unique is the fact that we have expert clinicians, nurse practitioners, teaching the courses. We have students who are able to work collaboratively in small classes. The ability to not only learn the theory, also to be able to practice the new skills that nurse practitioners will utilize every day in their practice.
How we facilitate all of that learning is through our high fidelity mannequins. For example, listening to heart murmurs on an infant. That is something we can replicate with our simulators. Or things like COPD in the geriatric population. And then when we don't need those technologies, depending on what we're teaching, we have a variety of task trainers where students can really just sort of focus on like individual skills. There is no patient population or skill that all students can get exposed to here. Cultural competency is a really important aspect of our program, and we not only emphasize that importance in our curriculum, but also in the technologies that we buy and install to support student learning.
Although at York we emphasize the clinical domain, beyond this aspect, there are opportunities for nurse practitioners in research, leadership, teaching, and advocacy. When students ask me which program they should go to for these types of opportunities, I tell them that York is the place for them.
When I first graduated from the program, really the only opportunities for nurse practitioners to work or to be employed was in community health centers. And now we have almost unlimited opportunities. We can certainly still work in traditional primary care models like community health centers and now family health teams and nurse practitioner-led clinics. We can have our own private practices. We can work providing service in long-term care. We can work, admitting, treating, and discharging patients in hospital. And so I think one of the most exciting things about taking the NP program is that the number of opportunities and doors that are open to you is essentially unlimited, and there will likely be new roles for nurse practitioners being created in the upcoming years.
The ability to work within your full scope as a nurse practitioner, it's just so incredibly valuable, especially within a rural and remote setting. When you're in a community that doesn't have any physician support and it's predominantly run by registered nurses who work in expanded scope, the reliance on the nurse practitioner is just enormous. The amount of influence that you can have over a patient to be able to change their life in that type of appointment far exceeds anything that you would have in some sort of reactionary care environment or reactionary medicine that would be provided.
As an NP, it doesn't matter how many years you've been a nurse. When you become an NP, it's a different ballgame. You're applying a different set of skills, you have a higher level of responsibility. We're giving students that clinical confidence even before they see their first patient, so that we can produce providers who can deliver safe patient care.
One of the big strengths of the Consortium NP program is that most of the universities in the province run it together, and they can combine their resources, their expertise, their staff, all of the preceptors, the instructors are primary healthcare nurse practitioners. Many of them will likely have graduated from the program already, and I think that's really critical for students to really be able to learn from those who are in the field, who are on the front lines.
The students are quite surprised at how well equipped they are coming out of the program with the new knowledge, advanced knowledge, with the skill sets that are required to provide that day-to-day care, to take their current knowledge and skill set and build upon it.
Every single patient that I've ever come across, they really value their time with nurse practitioners and really value them being the most responsible person overseeing their care. There's an absolute need for NPs right now. I think everybody's really seeing the worth and the value of this career, and we really understand that they are the answer to bridging the gap for access to care.
One of our priorities moving forward is to stay more connected with alumni so that they can be involved in training the future generation of primary healthcare nurse practitioners, as well as come back and participate in educational and leadership opportunities. It only takes one look at our alumni to know exactly how valuable the York University program is.